Bakit maraming beginners ang nalilito sa medical VA work? Simple, kasi ang US healthcare, hindi siya nagsisimula sa mag-answer ka lang ng calls or mag-schedule ka lang ng patient. Remember, behind every appointment, may patient information. Behind every services, may insurance rule. Behind every claim, may payment process. And behind every denial, may reason na kailangan maintindihan. So, if aspiring medical VA ka and feeling mo overwhelming ang words like eligibility, provider, payer, claim, denial, AR, prior auth, this video is for you. So today, we are not going to make it complicated. Again, we are going to simplify the basic US healthcare workflow like a beginner-friendly map. So headset on, copy ready, let's simplify US healthcare. Hi, I'm John Jepsane and welcome to MVA Simplified. I have more than 5 years of experience in US healthcare, accounts receivable or AR, and on this channel, we simplify medical VA work, billing basics, AR follow-up, denials, eligibility, prior authorization, and real healthcare workflows in simple Taglish. In this video, this is your Healthcare 101 session. We will answer one simple question. How does the basic US healthcare workflow actually work? By the end of this video, you should understand the basic roles of the patient, provider, insurance, claim, and where a medical VA may fit in the process. Let's start. The simplest way to understand US healthcare, huwag mo munang isipin lahat ng terms. Think of it like a simple story. There are usually three main characters: the patient, the provider, and the insurance. So the patient is the person who needs care, the provider is the doctor, therapist, facility, or healthcare professional giving the service. And the insurance, also called the payer, is the company or health plan that may help pay for the service. Simple example, Maria has back pain. She visits a physical therapy clinic. The clinic provides the therapy service. Maria has insurance through her health plan. After the visit, the clinic may send the claim to insurance to request payment. That's it. That is the simplest story that you can imagine for the patient, provider, and insurance experience. But that is just a general idea. Patient needs care, provider gives care, insurance may help pay, clinic sends a claim, insurance reviews the claim. Then, the claim may be paid, denied, rejected, or delayed. That is the basic road. Hindi pa natin kailangan gawing sobrang komplikado. Kailangan mo lang maintindihan mo muna yung flow, kung saan nagsisimula talaga ang Revenue Cycle Management or RCM. For now, remember this, US healthcare is not just about the visit. It is also about the information, coverage, rules, documentation, and payment process behind the visit. That is why medical VAs need to understand the workflow. So who is the patient? Of course, before there is a claim, before there is a billing, or there is insurance follow-up, there is always a patient. Sila yung critical character para mabuo yung roadmap na ito. So let's define this simply. The patient is the person receiving healthcare services. Pwede siyang magpa-check up, magpa-therapy, magpa-lab test, magpa-procedure, or magpa-consult sa provider. But in medical healthcare admin side, the patient is not just a name. A patient record may include important details like full name, date of birth, contact information, insurance information, appointment details, medical record number, service history, balance or billing information, at marami pang iba. And because this information is sensitive, hindi pwedeng basta i-share, i-post, screenshot, or pag-usapan publicly. As a medical VA, one of the first mindset you need is this: patient information must be protected at all costs. Simple example, if you are helping a clinic confirm an appointment, you do not casually expose the patient's name, date of birth, insurance ID, diagnosis, or account information. Even if you are just practicing, making content, or giving examples, we should use fictionals, names, and fake details only. Sa healthcare, professionalism starts with privacy. So kapag narinig mo ang word na patient, do not think customer lang. Think like this. This is a real person with sensitive healthcare information. So now, who is the provider? So sino nga naman ang provider? In simple terms, the provider is the person or organization giving healthcare services. A provider can be a doctor, a clinic, a specialist, a therapist, hospital, diagnostic center, facility, or another healthcare professional or organization. At marami pang iba. Another example, if Maria visits Dr. Smith for a checkup, Dr. Smith is the provider. As simple as that. Now, if Maria receives therapy from a physical therapy clinic, that clinic or therapist may be the provider. If she goes to a hospital for a procedure, the hospital may also be part of the provider side. Now, bakit ito importante sa medical VA? Because many tasks depend on the provider information. For example, who rendered the services? Is the provider in network with the patient's insurance? Is the provider allowed to bill for this service? Was the correct provider listed on the claim? Does the insurance recognize this provider? At marami pang iba. As a beginner, you do not need to master provider enrollment or credentialing right away dahil ibang expertise ang provider enrollment and credentialing. But you need to understand this simple idea. The provider is a healthcare site that performs or bill for the service. If the provider information is wrong, claims and payments can be affected. So again, healthcare is not hulaan. Information really matters. Next, what is insurance or payer? This is where many beginners get confused. They hear insurance, payer, plan, coverage, benefits, and everything sounds heavy. Let's simplify. The insurance or payer is the company or health plan that may help pay for the healthcare service. But here is the important part. Insurance does not automatically pay everything. Hindi porket may insurance ang patient, covered na agad ang lahat. Insurance usually has rules, and it really varies. They may ask a lot of questions. Is the patient's coverage active? Is the service covered? Is the provider in network? Is prior authorization required? Is the diagnosis or service medically necessary? Was the claim submitted correctly? Is there a deductible, copay, or co-insurance? Let's have a simple example. Maria has insurance. She goes to a clinic. The clinic checks if Maria's insurance is active. They also check if the service may be covered. If everything looks okay, the service happens. After that, the claim goes to insurance. The insurance reviews the claim and decides how much they will pay, if they will deny it, or if they need more information. So as a beginner, remember, insurance is not a magic card. Insurance is a set of rules. That line is important. When a patient says, I have insurance, the healthcare team still needs to verify the details. That is why eligibility verification exists. So, speaking of eligibility, what is eligibility? If you want to understand US healthcare, eligibility is one of the first terms you should learn because eligibility answers a very basic question. Is the patient's insurance active and usable for the service date? Let's make it simple. Eligibility verification is the process of checking the patient's insurance information before or around the time of service. Usually, the clinic wants to know, is the coverage active? What is the plan name? Who is the payer? What is the member ID? Is the provider in network or out of network? Does the patient have a copay? Is there a deductible? Is the out-of-pocket was already accumulated? Is prior authorization required? Are there benefit limits? At marami pang iba. So let's have a simple example. Maria has an appointment on June 10th. Before the appointment, the clinic checks her insurance. Now, if the insurance says active for June 10, that is good. But if the insurance ended on May 31st, there may be a problem. If the clinic does not check eligibility, the patient may receive a service and later the claim may be denied because the coverage was not active during the date of service. So eligibility is like checking the door before entering. Hindi pa siya payment guarantee, but it helps the clinic reduce the risk. For aspiring medical VAs, this is important because some medical VA roles include insurance verification, patient information checking, or assisting with front office tasks. So kapag narinig mo ang eligibility, just think about this. Active ba ang insurance? Covered ba ang possible service? May rules ba na kailangan i-check before the visits? That is the simple version. Now let's proceed to another term, which is prior authorization. So what is prior authorization? Now let's talk about another scary sounding term, which is prior authorization. Pero simple lang ang idea. Prior authorization or prior auth means the insurance may require approval before a service is performed. Think of it like asking permission first, not for every services, not for every payer, not for every clinic, but for some services, insurance may say, before we consider paying for this, we need to approve it first. So let's have a simple example. Maria needs a therapy service. Her insurance plan requires prior authorization for therapy. That means the clinic may need to request approval before the treatment starts or before more visits continue. Now, if the service happens without required authorization, the claim may be denied later. This is why prior auth is very important. Remember this, eligibility checks if insurance is active. Now, prior auth checks if approval is needed before the service. They are connected, but they are not the same. For eligibility, active ba ang coverage? For prior auth, kailangan ba ng approval before rendering a specific service? This is one of the most common beginner confusions. So let us make it clear. A patient can have an active insurance, but the service may still require prior authorization. So hindi sapat na active lang ang insurance nila. You must know the rules of the plan and the specific service. Again, healthcare is not hulaan. So let's proceed to another common term in US healthcare. What is claim? Now we reach one of the most important terms in medical billing, which is claim. So a claim is a request for a payment sent to the insurance. Let's have a simple version. So the clinic is just saying to the insurance that we provided this healthcare service to this patient. Here are the details. Please review and pay according to the plan rules. So a claim may include details like patient information, provider information, date of service, service codes, diagnosis codes, insurance information, charges, place of service, other required billing details. Now, do not panic sa codes. As a beginner, you do not need to master coding immediately. That's a separate topic. For Healthcare 101, just understand the claim like a formal payment request. Example, Maria received a therapy on June 10th. The clinic documents the service. The billing team creates or submit a claim to Maria's insurance. The insurance reviews it. Then the insurance may pay, deny, reject, request information, or apply part of the amount to the patient's responsibility. So a claim is not just a bill. It is a structured request that must follow rules. If something is missing, wrong, late, mismatch, or not covered, the claim may not be paid correctly. That is where billing and AR work becomes important. Now, speaking of claim, what can happen to a claim? So let's simplify the most common ones. When a claim got paid, it means the insurance processed and issued payment according to the plan rules. Now, if it's denied, it means the claim was received and processed, but the insurance decided not to pay for a reason. There could be a lot of reason for denial. Like, for example, have no authorization, not covered, coverage inactive, missing information, or medical necessity issue, at marami pang iba. Now, what if the claim got rejected? Usually, it means the claim did not pass the first submission checks or had errors before full processing. Let's have an example. A beginner mistake is thinking claims only have two results, paid or unpaid. But in real workflow, several things can happen. A claim can be paid, denied, rejected, pending, partially paid, sent back for more information, or applied to patient's responsibility. So let's simplify the most common ones. When a claim got paid, it means the insurance processed and issued payment according to the plan rules. Now, if it's denied, it means the claim was received and processed, but the insurance decided not to pay for a reason. There could be a lot of reason for denial. Like, for example, we have no authorization, not covered, coverage inactive, missing information, or medical necessity issue, at marami pang iba. Now, what if the claim got rejected? Usually, it means the claim did not pass the first submission checks or had errors before full processing. Let's have an example. Missing member ID, invalid format, incorrect payer information, or basic data issue. Now, for the claim is pending or claim got pended means the claim is still under review or waiting for a specific action. While for patient responsibility means the insurance processed the claim, but part or all of the balance may be assigned to the patient based on plan rules like deductible, copay, or co-insurance. Let's have a simple example. Maria's claim was submitted. Insurance reviews it. They may pay $80. They may deny it because prior authorization was missing, or they may reject it because the member ID was wrong. They may say the patient owes a copay. They may ask for medical records. That is why AR follow-up exists. AR follow-up is not just asking where is the payment. It is about investigating what really happens to the claim, what is the status, why was it not paid, what action is needed next. That is a big part of US healthcare revenue cycle work. Now, where does the medical VA fit in? Now, you may be asking, John, saan papasok ang medical VA dito? That is actually a good question. A medical VA may help in different parts of the workflow, depending on the client, clinic, and role. So, for example, a medical VA may assist before the visit, like scheduling appointments, confirming patient details, collecting insurance information, checking eligibility, helping request prior authorization, sending reminders, at marami pang iba. But a medical VA may also assist after the visit, like organizing records, supporting billing tasks, following up claims, checking claim status, calling insurance, updating notes, helping resolve simple issues. But not every medical VA will do all of this. Some roles are more of front office, some are billing focus, some are patient support, some are insurance verification, and some are AR follow-up. It really depends on the role. So as a beginner, do not pressure yourself to learn everything at once, but understand the map and the role and why it is existing. Because when you understand the map, every task makes more sense. Scheduling is not just putting a patient on the calendar. Eligibility is not just checking insurance. Prior auth is not just paperwork. Claims are not just bills. Denials are not just problems. All of these are connected in one workflow. And that is what we simplify here in MVA Simplified. So let's recap everything in the simplest way. The patient needs care, the provider gives the service, the insurance or payer may help pay based on the plan rules, eligibility checks if the insurance is active, and what benefits or rules may apply. Prior authorization is approval that may be required before certain services. A claim is a request for payment sent to insurance. The insurance reviews the claim. The claim can be paid, denied, rejected, pending, or applied to patient responsibility. And the medical VA may help in different parts of this workflow, depending on their role. That is your basic US healthcare map. Hindi mo pa kailangan maging expert. But now, at least, may starting point ka na. Now again, I want to hear from you. Which part of this workflow confuses you the most? Comment one word: patient, provider, insurance, eligibility, prior auth, claim, denial, AR, or any other things as long as it is related to US healthcare. Your comments will help me choose the next Healthcare 101 lesson. You do not need to memorize everything overnight, but you need to understand the workflow. Because once you understand the workflow, the terms become less scary. One workflow, one term, one skill at a time. Again, this is John Jepsane from MVA Simplified, helping aspiring Filipino medical virtual assistants understand US healthcare in simple Taglish. If this video helped you, like, share, and follow, and comment below. What should we simplify next? See you in the next lesson.